Withdrawal from substances can be seen in the newborn period. These are all going to be secondary to maternal intake. Don't forget that the newborn's past medical history is basically the mom's medical history. So what has been happening throughout gestation is affecting the fetus. If the mom has been doing drugs, then the fetus can be affected. Certain drugs, licit or illicit, can have teratogenic effects. And certainly with certain drugs, the babies will also develop tolerance and will withdraw because now the supply has been cut off. So these babies will withdraw from in utero exposure. The most common drugs that the babies will withdraw from are going to be methadone and heroin. And the timing of the signs and symptoms is dependent on the drug that the mom was using because it depends on the half-life of the drug. So for example, phenobarb, it has a long half-life, and so symptoms take a little bit longer to manifest. Same thing can be said of methadone. Methadone has a long half-life, and the symptoms may not appear for the first couple of days, whereas heroin, the symptoms appear a lot sooner because it's a shorter-acting drug. Same can be said for cocaine. Signs and symptoms are somewhat nonspecific. The babies can be very irritable. They can be hyperactive. They can root a lot, move back and forth. They can have fevers, diarrhea. Remember, narcotics tend to constipate, so as they're withdrawing from the narcotic, they tend to have diarrhea. They can have tremors or jitters, which are very fine little movements of the arms, hands, and legs. They can cry, be very difficult to console. Poor feeders, they may have fevers or even seizures. The best test for the diagnosis is your physical exam, history of maternal drug abuse, and then the best test after that is to get a urine drug screen on the baby looking for the certain drugs. Treatment includes comforting the baby, swaddling them. Basically, you wrap them up tightly so that it feels like they're being held all the time. And they may need some long-acting sedation and then weaned off of that as part of their treatment of the withdrawal. There are certain maternal diseases that affect the fetus and the neonate. There will be a chart in your notes that you basically just need to look at. Certainly things like hypothyroidism can affect the neonate. Certain diseases are listed in your notes. Also, maternal drugs affect the neonate. Certain medications that the mom is taking will affect the neonate, and certainly teratogenic drugs are also listed in your various charts. We will talk about fetal alcohol syndrome later, but you also have to remember, for example, that isotretinoin, which is used in the treatment of acne, can have serious effects on the fetus, and so therefore a favorite question is a female of childbearing age is going to undergo treatment for her acne with isotretinoin. What test you need to get on her? The answer would be a serum pregnancy test, and you also have to counsel her to not be pregnant, get pregnant while she's taking that medication. Also, certain drugs like phenytoin can cause certain phases in babies, and those are all listed in your table in the notes.